Hi, this is Dr. Vetere again, and Lizette, my patient, who's going to be helping us out. This segment, we're going to be doing some stretches for those people who have hip pain. Now, there is a fine line between hip pain and lower back pain, but there's some stretches or exercises that we're going to do in this segment that are different than the ones we did on the previous segment for the lower back pain, okay? It sort of starts out the same way. Lizette's going to lie flat down on her back. Again, do all these stretches and these exercises on a floor with a mat or a rug, something soft and supportive. Don't do it on the bed. It's too soft and you can actually hurt yourself on there. So we want to avoid doing that. Now, in the hip, there's a number of muscles, the gluteal muscles, again, the hip flexor muscles, some of the lower back muscles and the leg muscles that attach in and around the hip area to allow the hip to move in a number of directions, either forward, back, side to side, and rotation. So we're going to start off, we're going to take her left leg and we're going to put the left leg and we're going to cross it over on the right leg in this position. What this does is actually open up her left hip, and now what she's going to do is grab her right leg underneath her thigh, right underneath the thigh area with both hands, okay? And we're going to pull this up in this direction, and she's going to stretch her body. Now this is stretching the lower back, but what it's doing on my side, and we'll show it on the next scene when we do the other side, it's stretching the hip muscles and exposing the hip to a greater degree to allow increased range of motion in her hip. So as she pulls it up, you pull it up, you can see her face wincing a little bit, and then roll it back, grab it again, pull it up. Do that about 3 times until you feel a little burn. If you feel a burn, okay, let's bring this down, we're going to switch legs. If you feel a burn in the hips or any of the muscles, it's actually a good thing. So switch the leg, okay, bring it up, grab the leg, and you can see how that hip gets exposed. And the more she brings it up, the more it gets exposed. So you bring it up, okay, bring it up, pull it up, and then let it go back down. Okay, pull it up, let it go back down. And we're going to be stretching that inside rotation of the hip. It's very important. Now, put both feet back on the ground. Now, one of the conditions that I see a lot of times in my practice is something called a piriformis syndrome. It's very often mistaken for a classic sciatic problem where you may have a pinched nerve in your lower back, either due to a disc or a subluxation in your spine. But a lot of times, Liz, let's pick this leg up here again. Okay, there's a muscle that goes in your hip, from the outside of your hip, across to your sacrum. So it's sort of, it's a muscle that comes right across the lower part of your buttocks. The sciatic nerve crosses through that area, and that piriformis muscle can trap that nerve, giving the impression that you're having a sciatic nerve problem. Indeed you are, but the source of it is the piriformis muscle. This stretch, when you come up like this, when you're stretching it, you're actually stretching that piriformis muscle, which in a lot of times is part of the treatment plan of this piriformis syndrome, okay? Put the legs back down. The next part of what we want to do with the hip is keep the right leg, put that out straight, okay? And we're going to take the left leg and we're going to bring it over, okay? This is similar to the stretch that we did in the morning, our 5-minute morning stretch. So we bring the leg, let the leg stretch out, okay? Now, we want to stretch the leg up, and then you want to stretch it back down, keeping it as close to the ground as possible, and then you come over, and then you're going to switch legs. Let me move back a little bit so I don't get kicked by Lizette. Bring this leg over, okay? You're going to bring it here. This is going to stretch the whole hip area out, and then she brings it up, and that increases the range of motion, and it causes other muscles that are in the hip to be stretched out, okay? Let's bring this back up. And we're going to come back and bend the knees up into a comfortable position. Flat on, put your feet flat to the ground. Always when you're doing these exercises on the floor, you want to sort of end up in this position, even before you get up, okay? It's a very stable position. Now, the last exercise we're going to do for the hip is we're going to stretch out the anterior portion of the hip, or the front of your hip, or those notorious hip flexors like we spoke about with the lower back, causing pain by pulling the back, the front of the lower spine forward. Now, we're going to get up, okay, and what we're going to do is we're going to do somewhat of a lunge position. Now, the way we're going to start off, Lizette, is this. We're going to take our left leg, and unlike doing a lunge exercise, we just want to focus in on doing a stretch of the anterior portion of our hip. So what we're going to do is we're going to take a nice step forward with your left leg, okay, a little bit more. There we go. And the object of this is we're going to stretch down as far as we can, stretching this forward. We're going to be feeling the stretch right in this area of the groin. You feel that? Okay. Feels good, right? I just bet. Okay. So we want to stretch down, hold that stretch for about 5 to 10 seconds, and then you come back up, and of course you reverse it. Okay. Again, you widen the stance out. Again, you stretch down, stretch, 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 and you're sort of going right into that stretch all the way down, and you'll feel it across your quadriceps and right into the groin area also, okay? So this will allow this area of your spine to become more flexible, this area of your hips to become more flexible, which will help with the balancing of your spine, okay? And again, remember, any type of prolonged or persistent pain, make sure you see your healthcare provider to check out and make sure you're safe to be doing these exercises.